Hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Dave Jansen, and I'll be your host. Today we're going to be hearing from Tim Smeeding about the latest Wisconsin Poverty Report, which was released on June 24th, and about why the state's improving economy hasn't done more to reduce poverty in Wisconsin. Smeeding is the Lee Rainwater Distinguished Professor of Public Affairs and Economics here at UW-Madison and was Director of the Institute for Research on Poverty from 2008 to 2014. He's a widely recognized expert on poverty measurement and, among many other things, was part of a National Academy's panel on reducing child poverty that released a major report earlier this year. So, Tim, thanks for being here with us today.
Thanks, Dave. Nice to be with you and with everyone else.
We're glad to have you with us. I also want to thank the Office of the Assistant Secretary for Planning and Evaluation for their support of this webinar series. That said, any positions expressed in this webinar are not necessarily those of ASPE, any other agency of the federal government, or the Institute for Research on Poverty. So with that, Tim, thanks again for being here, and I'll turn it over to you now.
Thanks, Dave. This is the 11th Wisconsin Poverty Report, and the subtitle is Treading Water. Of course, the report was produced with the help of Dave and a number of others here at the University of Wisconsin-Madison and the Poverty Institute, including Katie Thornton, who does the programming every year. But the opinions I'm going to give are mainly my own, especially about what to do about the policy hole or the lull we seem to be in. So let's get started. As of the dates which we look in this report, we're 8.5 years into what is now a 10-year recovery, and we're still treading water. We haven't made a lot of progress, and I'll explain why as we go. So we want to talk about a number of things: the measure, the findings, why we found what we found, and where to go from here. And then we'll sum up, and then I look forward to your questions. So it's going to take me about 30, 35 minutes if all goes well. So here we go. So the history of the Wisconsin Poverty Measure is on this slide. And you can see that the official measure you know about, there's the National Academy of Sciences report. In 1999, IRP at a conference hosted by Bobby Wolf, what do we know? And we decided we needed to move forward. And finally, New York City moved forward with a local poverty report, thanks to their hard work. And in 2010, we did our first Wisconsin Poverty Report and the WPM for 2008 income year. More or less at the same time, our Chancellor, Becky Blank, was the Secretary of Commerce, and they first released the federal SPM, which is very close to our measure, in 2011. Last year, we did a supplemental report on poverty, incomes, and race in Wisconsin in 2016. We may do one later this year on children. But for right now, here's the 11th annual report, which was released last month. So it's pretty simple. Most of you understand this, but I'm going to go through it for the rest, about two methods of poverty measurement. And in all measures of poverty, you have a measure of needs and a measure of resources, and those are really important. So the first slide deals with resources. As you all know, the official measure is cash only. Nobody pays any taxes. And it was fine for 1960, but we're not living in 1960 anymore. The Wisconsin measure is much more comprehensive. We take out payroll taxes that low-income people pay and income taxes that some pay, and most importantly, we put back in refundable tax credits like the Earned Income Tax Credit, the Child Tax Credit, state EITC as well. Also important, we add non-cash benefits, food share, SNAP, rental vouchers for housing, very important. And then we subtract out work-related expenses for transportation and child care because it's not right to count the benefits of going to work, the EITC, without counting what it costs you to go to work, and that can be important for low-income families. That's the resources. The threshold side, the official poverty line, as you all know, developed in the 1960s. Emergency food costs times 3. Adjusted for prices only since then. When it was first initiated, it was about half of median family income. Now it's below 30%. So in terms of a meaningful standard of living, it's probably fallen. If you're a fan of the food times something concept, great. Multiply food by 6 or 7 now, and you get twice as high a poverty line. Instead, we use the SPM method, and we look at basic expenses on food, clothing, shelter, and utilities averaged over 5 years from the Consumer Expenditure Survey. And then we have to adjust it because the Wisconsin cost of living overall is only about 92% of the national one. And just like the SPM, your housing tenure matters, whether you're an owner or a renter. We adjust for regional prices and out-of-pocket medical expenses, which turn out to be important for the elderly in particular. So there are the two things that are key. Now, the third key thing before we get to the numbers is what's a family and who's considered. The official measure is based on the census family unit. You're married or not married, or you must be related by blood, marriage, adoption. If you're not married, unmarried partners are treated as single people. The Wisconsin measure, like the SPM, adds to the census family unmarried partners who are living together as couples. It also includes foster children, and most importantly, we remove college students living off campus who do not work. That makes a 2 percentage point difference in Madison, Wisconsin. If you ever looked at somebody who didn't know what they were doing and looked at the highest white extreme poverty areas with 40% poverty, and you started seeing things like Madison, Wisconsin, Ann Arbor, Chapel Hill, you'd say, wait a minute, and you're right, they're counting students. That doesn't make sense, so we don't do it. We're part of the don't make sense, don't do it group here. Okay. So there we are. Here's a little bit more. We use public use data from the ACS. We get the 66% sample late every fall, and then we do our thing with it. Okay? The federal SPM, of course, uses the CPS. Poverty thresholds are adjusted within and across the state, as I mentioned. The tax model includes federal and Wisconsin income tax laws and payroll taxes. Importantly, SNAP benefits, housing assistance, energy assistance are based on state administrative data and eligibility. We spend every dollar that the state spends. There's no underreporting there. Okay? And child care and work expenses are based on federal data, however. And medical cost expenses are based on regional estimates that capture what's been happening with medical care prices and particular out-of-pocket expenses in our region. Now, so what are these thresholds? How much are we talking about? The national experimental SPM line was 29,380 in 2017. Okay? The Wisconsin line is 92% of that, as I said before, 27,241. The OPM line is 25,094. And the OPM line is the same all over the place. But what you're starting to see here now, if you look at how low-income people really live and work, you're starting to see a differentiation between the Wisconsin poverty measure, or the SPM, and the official line, because we're actually looking at how people live at the bottom of the distribution and not just at something like food times 3. So, last thing to remember, there are 3 different measures. First, market income poverty. The Census Bureau, for some reason, does not publish market income poverty numbers. They should. This is poverty before taxes and transfers. It represents private income only, particularly earnings for the non-elderly. Income from investments, private pensions, private transfers are in there, like child support, but it's before taxes and transfers, essentially. Market income poverty movements are important because the more that they move up and down, you can tell about the success or lack thereof in the labor market of low-income people. Then we have the official poverty measure, which is just what you've seen before, and then the Wisconsin poverty measure, which does all of the things I mentioned above. So you're going to see 3 lines in most of the graphs. Okay, findings. Where are we? How did things change over the past 10 years we've been doing this? What were the effects of the economy and policy? How does poverty vary by age? How does it vary across the state? Now, you have to remember the important footnote at the bottom here. If you're an ACS user, you know this. The ACS collects 2017 data from the period January 2016 to November 2017, right? That is, they ask in what your income was in November 17 over the last 12 months, and the last 12 months go through January 16 to December 16 and so on. So as you do this month by month, you end up with the period being 12 months but covering a different period for each group. Anyway, most people understand this, I think. So here's where we are overall. In terms of market income poverty, for everybody, children and the elderly, poverty is fairly high. It's in the 20% range for everybody, and for families with children, a little bit lower, which is good. And for the elderly, it doesn't make the most sense. If they're retired and they're living on Social Security, you have a high poverty rate. The official poverty rate is lower for everybody, a little bit higher than what you might expect for children, but it's not counting the ITC and the SNAP benefits, and the elderly are lower. Now you go to the Wisconsin poverty measure, and things are pretty uniform. All right, 10.2% for everybody, 10.1% for children. This is the first time I think children are below everybody, and the elderly at 9.5. So elderly went up and children went down, and all looks pretty much like all. But there's a lot going on under the surface that we're going to look at now. Here are the Wisconsin poverty rates using the three measures from 28 to 2017. The top line is market income poverty. And you can see it rising during the recession when jobs weren't available, recovering slowly. Big hopeful 2015, all right, we're on our way. Well, last year bounced back up, back down now. Basically, 2017 is indistinguishable from 2015 at 22.5. The official poverty rate has plunked along. It went up, and it's come down a little bit. That's just on cash only, but mainly that looks a lot like the line above it, the market income poverty line, because that's really what's moving the official poverty for the non-elderly. And in Wisconsin, we started out higher, then we went lower during the Great Recession because we really did a great job with the ARRA benefits. And then we've been sort of bouncing along. Again, 15 looked great. 16 looked bad. And in 17, we're back to 15. In other words, that's why we call it treading water. So the next slide says what I just said here. Okay? The important things are that we've had some job increases after 15, but they're not enough, and they're not great jobs, as you will see. The safety net worked really well through 15. 16 and 17, we got rid of some people on food stamps, single people. And in November 2013, nationwide, SNAP benefits were reduced because for some reason, people who needed to eat more during the recession didn't need to eat as much after November 2013. Don't ask me. Ask somebody who made that policy. Along the way, labor market's doing better, but we have low and falling real wages, as I will show you in Wisconsin, that aren't helping. Work-related costs and medical costs are inching up all the time, and they're offsetting benefits. And the bottom line is we're treading water. This picture is a perfect illustration of why we're treading water. We're at 10.3% poverty in this state, according to the Wisconsin poverty measure in 2010. We're at 10.2 in 2017. We've been essentially between 10 and 11 since we began. Well, wait a minute. Maybe that's good, but maybe it isn't. You have to remember we're now in the 10th year of the longest recovery of the U.S. economy ever. The recovery wasn't as strong as the last one, but it's the longest one, and still we're not doing well. So what's going on here? We'll see. So unemployment is low in Wisconsin. The governor used to 2.9% unemployment, but job gains are really slowing now, and actually in 2018 they fell. Real wages in low-skilled jobs are falling, and what's very important for people to understand, work in the low-wage sector is unstable and rarely 9 to 5 or full-time full year. If low-income people don't take the kids to school or to the daycare in the morning or to the bus, go to work, and pick them up after. That's just not the way low-income people work. And then SNAP enrollments in Wisconsin are falling, including for families with children, even if there's been no overt legislation, and we don't know why they've been falling. It's natural that they might fall some because of an economic recovery, but ours seems disproportionately large, and we're trying to figure that out. So key changes in Wisconsin's labor market. Annual job gains since 2015 have been 40,000, 38,000, 35,000. Okay. And if you look during the ACS time period, it's 64,000. That's, all of 16 and most of 17. And last year was 71,000, so it's slowing. But the big problem, real wages for many low-wage jobs in Wisconsin have been falling. Food preparation, fast food workers, maids, housekeepers, waiters, retail salespersons, janitors, and cleaners were all lower in 2017 and in 2002, and with no real gain since 2010. How do I know that? I'll show you in a minute. So here's the job gains, and you can see the annual changes in private non-farm employment as they come trundling out from the Department of Labor, and you can see the period 1/1/16, 11/17, and you can see that things are going up, but not as fast as they were before. And if you overlay next year's, you'll see things sort of are hitting the rock. So jobs are gaining more slowly. But here are wages. This is important. These are real wages using the CPR-URS deflator, okay, since 2000 in three big low-wage occupations: personal care and service occupations, taking care of the elderly and so on, retail salespersons, and food prep and serving. And you can see that in 2017, the numbers in bold, 1137, 1076, 975, are all below where they were in 2001, and more or less the same or lower as in 2010. So the low-wage sectors in Wisconsin have not been recovering with the rest of the nation. Just to make a point for later on when we say, well, how might this be affected by wages? We just did the same thing for our friends next door in Minnesota. And Minnesota was following roughly the same pattern as was, there are the hash lines, as was Wisconsin. And wait a minute, they increased their minimum wage in 2014. And bing, 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 they all bounced back. The minimum wage today in Wisconsin is $7.25. The minimum wage today in Minnesota is at least $11 if you're in a small firm and $12.25 if you're in a large firm. A correlation may not be causation, but these patterns can be traced to something that I think we know is going on. We'll talk more about that later. Okay, on we go. Now, income supports are important, and that's why the SPM is important. We fight poverty in our country through nutrition programs like SNAP, WIC, and school lunch. We fight poverty in our country through refundable tax credits, the federal and state EITC, child tax credits, and the additional child tax credit. All really important. Child care subsidies for what's called Wisconsin Shares in our state, and medical insurance coverage like Badger Care also help reduce poverty because they reduce out-of-pocket expenses for things that you can't use for food, clothing, and shelter. So we'll see this as we go along here. Here you go. What programs are important in fighting poverty? Well, the only cash program there that we're looking at is AFDC and TANF, and it hasn't done anything more or less since the early 2000s. It's been a flat nominal amount, non-responsive to the recession. Now, on the other hand, SNAP, the child care tax credit, and the additional child care tax credit, all of those went up great guns because of the ARRA, and they haven't come down as fast because people are still earning low wages. I have a paper in demography with Jim Ziliak and Brad Hardy that makes this point. If your wages are low, you're still going to be receiving the EITC, you're still going to get refundable tax credits, and you're probably still going to be getting SNAP benefits. So those are down, but not as much as you'd expect, and this is the latest data through 2016. So the WPM counts the things that matter. Here are SNAP benefit caseloads. Now, I'm proud to say in Wisconsin, during the Great Recession, where that green line goes up faster than the United States, there was an overt positive effort in this state to make sure that everyone who was eligible for SNAP benefits got it. It was impossible to go to any aid-office, soup kitchen, food pantry, and not have somebody there say, you ought to be on SNAP if you're not. You can apply online. You got a debit card that was easily disguised. The shame was out of the game, and we went up much faster than the rest of the country, and it really helped, especially in the rest of the state. Now we've fallen down like the rest of the country. Now some of you may say, hey, what's that blip, that black line blip there around November 2017 in the rest of the country? Well, what that is bad weather in Texas and hurricanes in Florida. And yes, SNAP was very responsive to people who had lost their homes, had lost their livelihood, and couldn't eat. So SNAP does help people in emergencies, and that's exactly what you can see, because the states that went bonkers during that period and then went back down, we checked all the national data, are Florida and Texas. In Wisconsin, Milwaukee has always been fairly high and stayed high because things aren't going well in most of Milwaukee for poor people, as we'll see later. So that's the SNAP program. So here's the highlights. I think I've hit them all. I don't have to spend much time here. These are the sorts of things that we see overall. Now we're going to look in some detail, but the highlights are in this slide, and you can quickly look at them. Now, what about families with kids and the elderly? Now, families with kids, we had some success in terms of market income poverty falling due to more hours, not higher wages, as I showed you before. And we see the official poverty measure in Wisconsin measure fall this year, but it's still about the same as 2015. So even in terms of kids, we're treading water. We'll see that in a minute. Elder poverty jumped up, mainly because of medical expenses, and we'll see that in a minute too. So here we go. Here are child poverty. And the good news is market income poverty for children is falling. Parents are working. Parents in Wisconsin work. Message noted, I hope. Low-income parents are working. Single parents work more than, single women work less, Single parents work more than married parents, and single parents work almost as much as single women. And you can see that the market income poverty rate was 21.6 in 15, stayed flat last year and went down again this year. So that's good. Low-income families are trying their best to do what they can to escape poverty if they're parents with kids. The official poverty measure bounces around like we saw down there at the in the middle. It goes up and down to 14.2. That's good. And the Wisconsin measure dropped from 12 to 10.1 this year, but that's still above the 10% we had in 2015. Bottom line, we're treading water for kids too. Elder poverty, the changes in prices during the periods in which you're looking at things and changing the poverty line, vis-a-vis the Social Security cost of living increases that are annual make a big difference. If the COLA is caught up with prices, you see fewer elderly poor, as we saw in 13, 14, 15. But then when the COLA's prices are low and the COLAs aren't as high, we see poverty rising slightly in the official measure from 15, 16, 17, and then really rising 7, 8, 9, 9, 5 in the Wisconsin poverty measure. And that rise in the Wisconsin measure is because of medical out-of-pocket expenses. So here are 4 levers. I want you to focus on this. Now, there are 4 things, policy levers that we have. One policy lever is refundable tax credits, like the ITC and all the others. Another one is non-cash benefits like SNAP, public housing, and LIHEAP. More of those pushes poverty down, all else equal. Work-related expenses like childcare, on the other hand, go the other way. The higher they are, and the higher our gas prices and community costs, and the less people have left to spend on everything else, when you subtract them, poverty is higher, and out-of-pocket health care costs the same way, affected by Badger Care, Medicare, and what it costs for out-of-pocket expenses in terms of deductibles, co-insurance, and so forth. If you spend more out-of-pocket, poverty goes up because you got a lot less left for other things. And we illustrate that every year with the diagrams like this. So here are our levers. This is for the overall poverty in Wisconsin. You can see that the tax lever in the blue bar is reducing poverty, but by less than it did in previous years. So refundable taxes are something less. You can see that SNAP is fading even faster. Its kick is about the same this year as refundable taxes overall. Housing programs are good. You pay a third of your income towards rent. That's stable. And energy assistance has been helping. On the other hand, all those things push poverty down. On the other hand, the higher our work expenses or medical out-of-pocket expenses, they push poverty up. And they pushed poverty up pretty much in 17 as more and more people went to work, in 15, 16, 17 for work expenses, and pretty steadily for MOOP, medical out-of-pocket expenses. And if you went overall, the blue bars below the line, and you added them all up compared to the blue bars above the line, they more or less cancel one another. So in other words, the amount of benefits that you're getting is offset overall by work expenses and medical out-of-pocket expenses. Now I say overall because there's a big variance by subgroups, as we'll see in a minute. So here's children. Now notice the left-hand scale is bigger. Taxes, refundable tax credits like EITC and the child tax credit do a lot more for kids. They're family size adjusted. You get a child care tax credit for every child, so the more kids you have, the bigger the kick. So there's a big, nice negative effect from refundable taxes, federal, state, and local here from the taxes. And SNAP, it's less. Now, why is less for kids? I ask the same question. Is this just because of the recovery? I don't know. It looks like it's faster than the recovery. So those two are the big programs that reduce poverty. Housing does a bit, although public housing, less than half of public housing units go to families with kids. They mainly go to elderly and disabled. That's true everywhere. A little less from energy assistance. Oh, yeah, they have work-related costs and, yeah, to a lesser extent, medical out-of-pocket expenses. But when you add up the things that push poverty down versus the things that push it up, the things that push it down are much bigger for kids. So the net effect is to really reduce poverty for kids when you take account of all these public benefits and expenses. Elders, the last one to look at. Taxes aren't that important. They aren't working much. SNAP is doing a better job for the elderly. Housing programs are hanging in there as energy assistance. A little bit of payroll taxes paid, but then bang, out-of-pocket medical expenses, MOOP. And MOOP, the increase in MOOP, the last blue bar, outweighs all the other bars by twice. So that's what's driving elders. So it's just what I said here. This is just a quick summary. SNAP and refundable tax credits are #1 poverty funding programs. Families with kids are much more important. Tax credits and SNAP, medical expenses for the elderly, and so on. Okay, we got that done. Onward. Highlights, work-related costs, pushed up poverty for families and kids, and they increase with more work effort. You need more child care, more transportation, and so forth. Medical expenses reduce money for other stuff, and those costs are going up faster than overall prices in Social Security COLA increases. Now, the local TV news ran a piece on this, and they called the county office for the rights of the disabled and the elderly, who have a whole separate health care hotline, and they say we get 10 calls a day about this. If you, oh my God, I've got this huge medical bill, what can I do? And they tell you whether you qualify for Badger Care or not, or something else to help relieve your bills. Housing benefits could be more expensive, effective, expanded, especially for families with kids, as our National Academy of Sciences report showed. And the expenses were about the same as benefits in 17 for overall. Okay, we've summarized all that. Now, let's look within our state. The overall rate of 10.2 for our state is that. It's pretty solid, small error bound, and so forth. But there's a lot of variation across the state, within large counties and by race. So the ACS can accurately show poverty in areas of 100,000 or more persons. And in Wisconsin, we have 8 Pumas within Milwaukee County, and on the other hand, you have 9 counties in Northwest that you have to put together to get 100,000 people. So we'll look at a map in a minute. Milwaukee sticks out every year in great detail as our high poverty area. If you don't solve poverty, and particularly African American poverty in Central City, Milwaukee, you don't solve poverty in Wisconsin. As we get closer and closer to the Democratic Convention, you're not only going to see the rosy stuff about Milwaukee, you're going to find the most segregated areas in America. You're going to find lots of trauma. You're going to find lots of imprisonment. You're going to find a lot of low-income poor people who can't afford housing. Okay. Then this year, Eau Claire and Chippewa popped up too. Can't exactly figure out why. I talked to Eau Claire reporters last week. They're not up that high. They're maybe a point above. If they were a point lower, they would not be significantly different from the state average, but that's a little blip. But this year, it's lower in 27 counties. The suburbs north and west of Milwaukee in particular, Waukesha, Washington, and Ozaukee counties are the lowest poverty areas in the state. Poverty rates there are 4 and 5% compared to 17 in Milwaukee. But even within Milwaukee County, the variance is huge. Within one county, poverty rates vary from 7 to 34.4%, and child poverty from 4 to 34.6%. Within the county. Segregation, your name is Milwaukee. Black poverty is more than twice as high as overall poverty and roughly 3 times white poverty in Wisconsin, and 3/4 of the blacks in our state live in Milwaukee County. So here's a map that shows you that. The orange ones are the ones that are significantly higher than 10.2% statistically. We've got Eau Claire and Chippewa. They're a little too far to be a suburb of Minnesota, like St. Croix, Dunn, and Pierce. From the state line over there to Minneapolis is a 33-minute commute. So you're looking at the suburbs of the neighboring state where those minimum wages, et cetera, are higher. But Chippewa and Eau Claire, you know, they have their own issues, I'm sure. I'm not sure what. They never stuck out last year. It may be a one-year blip. We don't know. The vast swath of the state, including Dane County with Madison and Rock County, Greene County, is in gray. They're not different from 10.2. And then the manufacturing belt north and west of Milwaukee through Fond du Lac, Manitowoc, Sheboygan, and so forth are doing better than the state average. They've recovered pretty well. Unemployment rates are low, and wages are somewhat higher there in their industries. So that's what we have for the state. Okay, where do we go from here? Well, it seems to me that if we really want to get off of the lull that we're in and stop treading water, we need more work supports and we need more income supports. So let's talk about both of those, okay? First of all, the job market's not helping the poor as much as it could, despite greater work effort on their part, particularly for parents. We could do more to increase work support services and therefore earnings. More employer-led training, placement and apprenticeships, especially for the hard to employ, like the formerly incarcerated. There are pockets, there are good stories, there are great nonprofits out there who are taking people out of prison, helping them meet the needs that they have, getting them housed, stabilizing them, training them, and putting them to work in the low-wage sector. God bless all of them. They're doing as best they can. Okay? That's important. We haven't seen the total effects of it yet, but now is the time to do this. Now, you should know, by the way, that in our great state of Wisconsin, the prison population has not fallen since 2015. In fact, it's increasing, and it's forecast to increase. We have some serious issues that we need to deal with here, and there are racial issues too. We incarcerate a fraction of blacks in our state who are incarcerated is as high as in any state, and we haven't found a way out of that yet. The governor's working on it, but he's just been in office for like 6 months, so we haven't made a dent there yet. We need transportation assistance for jobs for people in central Milwaukee. Employer Uber, there's lots of things, public transit system that work that got people to where the industry is can help. Most importantly, though, are the last three. A higher minimum wage. The governor and I independently have proposed moving to $10.50 an hour in Wisconsin by 2021. $10.50 is not huge. It's not 15. 15 is not going to work. 15 an hour is not going to work in Wisconsin. The median wage in the state is $17. But we can at least get to $10.50. And if we did that, more people would go to work. More people would gain jobs. Few people would lose jobs. And that would really help push those poverty rates down. We should be doing that. No one's talking about it in our state. The legislature refused to consider it. And so we're at 7.25, one of only 20 states that are still with the federal rate and the only one in our area. You saw before the contrast with Minnesota. More and better child care options for families with children. This is incredibly important. We need more subsidized child care. They can't afford high-quality care. They can afford to work some, but people will say to me all the time, hey, we don't need a higher minimum wage. Quick Trip, which is our locally owned and run 7-Elevens, pay $12, $14 an hour. Yeah, for the 3 to 11 and the 11 to 7 shift. It's hard for a single parent to find child care and do that. Okay, enough said. We need child care. And then the Medicaid expansion. We have again refused to take the Medicaid expansion. We're more than willing to send federal taxes to Washington, but if it's a Washington tax, D.C. federal tax dollar, we won't take it. So if we had expanded Medicaid, there would be a big infusion of income, of money for health care into our state. It would reduce opioid use and help more single people get help. It also means that you can help people take jobs without losing health insurance. Expanding Medicaid is the right thing for Wisconsin to do. We haven't done it yet. So there's 3 things we could do. And those are all work-related. Those all increase self-sufficiency. They provide work support. They help people work longer and better and make more money at it and drive down market income poverty, which everyone can agree with. Now, income supports. Based on their National Academy of Sciences report on child poverty, mandatory work requirements for parents are likely to increase poverty, and work alone won't solve the poverty problem for parents and kids, and likely not for childless adults either. Work alone is not going to do it. If work alone would do it, market income poverty would be really low now, and it's not in our state, not anywhere. You need income supports too. We should expand the federal EITC 2 ways. One's for single people and also for a little bit more for families with kids. We had a bill for an expanded state EITC, which wasn't considered by the legislature. It was in the governor's budget, and it disappeared. More affordable housing would help. Definitely help. We don't have that, although there are a lot of nonprofits working at it. Better coverage of out-of-pocket medical care for low-income elders especially will be really helpful. Again, with Medicaid expansion, we could afford to do more of that. We didn't take it in our state. And finally, something federal. As our National Academy of Sciences report shows, a fully refundable federal child tax credit of $2,000 per person paid monthly as a child allowance will go a long way towards, it would eradicate deep poverty and extreme poverty. It would mean there's some money at the end of every month for anybody who wanted it, and it would make the jobs of all the people who are trying to do everything else to get people employed, to do more affordable housing, to feed people much easier if we had that policy in place. That's a federal policy, and that comes out of our National Academy report. So, there we are. I'm almost done. Let me just sum up. Our report shows poverty is affected by both the economy and public policies. The 8.5-year recovery, which is what we see in this year's report, next year will we'll see pretty much the whole recovery, is not delivering enough for poor families and workers. You're just treading water. Jobs and earnings gains are important, but not enough. Benefits fell due to the recovery and cutbacks and reductions in SNAP. We don't know exactly why. Payroll taxes, work expenses, and out-of-pocket medical expenses all rose, and that pushes poverty up, all else equal. Central City, Milwaukee is still struggling with the minorities who are living there, but a large fraction of our counties are doing better than average. If we want to do better and break through, we need to increase wage, work supports, and income supports. And the governor has finally done something. He vetoed the budget that funded mandatory workfare for SNAP families with the youngest child of school age. The former governor had passed that. There is no money now to carry that program out, so we won't be forcing single parents to work 30 hours a week, with a school-age kid to work 30 hours a week, or lose their SNAP benefits. Yay, Governor Evers. Here is where you can find things. You can get the short summary in the report. You can get all the information about the technical things. And the next one, David Johnson and I, in 2012, wrote a consumer's guide to interpreting all the U.S. poverty measures, ACS, CPS, SPM, official, and so forth. I will not talk to a reporter who hasn't read that. And if they've read that, then I'm happy to talk to them, so they don't have to ask the same basic questions again and again. And then our race and ethnicity supplement for last year, which focused particularly on black poverty and ethnic poverty in Milwaukee, but also in the state. I'm done. Shoot.
Okay. Well, thanks, Tim. I just want to remind everyone to start submitting their questions in the Q&A box at the bottom of the screen. As we get started, Tim, you talked a bit about Milwaukee and some of what we're seeing there, but could you dwell a little bit on some of the child poverty that we're seeing there in Milwaukee, especially disparities by race, and there and in other places in Wisconsin? What can you tell us about that?
Well, in general, I'm a big advocate of reducing child poverty. I would like to make a serious dent in it, which is why I joined the National Academy Committee. And what we find in Wisconsin is that the economic situation for minorities is not great, particularly for African Americans. And those African Americans live, like I said, more than 70% of them in Milwaukee, another 12% in Madison, and the rest are scattered elsewhere. What you find is if you go to Central City, Milwaukee, you find that joblessness is high, incomes are incredibly low, a lot of single parents, a lot of violence and trauma, and a lot of segregation. So Matt Desmond, who everyone knows, I was a member of Matt's committee, and he thanks me in his book for policy advice. Matt wrote his book, Evicted, about how people couldn't afford to pay their rents in Milwaukee, particularly low-income people, and particularly in the areas I'm talking about. Now, you have to understand there are two reasons why people can't afford to pay rent. One is rents are really high. That's the West Coast and the East Coast phenomenon near central cities. The other one is rents aren't particularly high, but incomes are really low. That's Milwaukee. Okay? Milwaukee is also where Mary Patillo came from. Milwaukee is where Raj Chetty came from. Milwaukee is where Diva Pager wrote The Mark of a Criminal Record, which showed that an African-American man in Milwaukee who had not been in jail was less likely to get called back for a job than a white man who had been formerly in prison. So Milwaukee has a serious central city problem with segregation. Segregation amplifies everything else. It's not segregation alone. You've got a teen pregnancy problem there, the highest rate of black teen pregnancy in the nation. The good news is that rate's been falling, but we're still the highest along with Arkansas. And we've got a situation there that needs some deliberate public policy intervention to get people to jobs, to provide child care for their kids, to improve the schools, and so on. So that's the real touch point for minority poverty in the state. Madison has some of its own issues in certain isolated areas, but I think it's doing better with them than is Milwaukee. Does that help, Dave?
I think that helps, Tim. Thank you. Our next question is about market income poverty. You touched on that briefly, about how the Census Bureau does not really share that. Could you tell us just a little bit more about market income poverty and maybe why it's not a more widely used measure?
You know, I don't know. And then I've talked to the Census Bureau people about it, and they say they're working on it. I mean, market income poverty for non-elderly people essentially reflects their earnings. And if the answer to poverty, which I think it is a stable job that pays enough to support a family, then market income poverty is what you want to focus on. You want it to fall. The more it falls, the less we need all the other programs that we talked about to help people become self-sufficient. And I concentrate on it. The people at the Columbia Poverty Center concentrated on it all the time, Chris Weimer, Jane Walfogel, and others. And most people who are serious about poverty reduction through the labor market look at it, because that's where you can tell how it works. I do not know why they don't do it. They should show market income poverty before taxes and transfers, and then after people pay their federal taxes, and then they get the income support benefits, cash and non-cash I mentioned. That's just a no-brainer. But why, I don't know. Everyone else talks about it. We've been talking about it for 11 years, and guess what? We'll talk about it for another 5 or 6, or as long as I'm doing the report.
Okay. I'm going to set the slide back to that previous one so people can access those reports. But our next question, I'd like to think about a little bit more about how the Wisconsin poverty measure can be used, and especially how it can be used to inform policy, maybe in ways that it's not currently, or how you could expand it. What do you see here as an opportunity for sort of policymakers to draw on these lessons, and maybe other areas that you could expand to that could help our state?
Well, people look at it, and you look back. It's not quite up to date, but if you combine a couple of years, of the data, you get much stronger focus on smaller areas. You could run simulations. The California measure, which I advised on, which is very similar to our measure, has been used to show the effect of the $1,000 family tax credit that they just passed, how much that would reduce poverty. If we raise the minimum wages in our state to $10.25, I could simulate how many more people would be working, how much more they would be making, how much less they would be drawing down in terms of food stamps, how many of them would be paying more rent for public housing, and so on. So it's very good for simulation work if you want. You can focus in on children, elderly, and a whole number of other areas. You can talk about offsetting some health care costs. So there's a lot of, unexplored things or untapped things that could be used here to dig deeper into poverty. And I know there's interest because every year people from I've been on the radio talk shows in Madison 3 times, in Fond du Lac, and in Janesville, in La Crosse, and now I'm talking with somebody in Green Bay on Friday to find out what's going on in their area. People are aware of this. They're looking at it. They're wondering out what's going on. So you could do a lot more if we had a little more resources, and we could do some interesting simulation work and more in-depth work that would help policymakers understand what's going on in their areas and why they're not doing as well as they'd like to think they were.
Okay. We have a few questions about child care. You mentioned child care as a work support, or as a way to kind of help lower income families work a little bit more. Could you talk more about what a policy like that might look like, who you'd maybe target it to make it affordable, and just kind of give us some background on what those policies might look like?
Okay. Well, first of all, there are high-quality subsidized child care slots through the SHARES program through the Department of Children and Families in the state of Wisconsin. There aren't enough slots for everybody, and those slots are mainly, for 9 to 5 or day driven. We need to make better use of those. We also need before and after school care and summer care if you've got school-age kids. The Dream Up project in Wisconsin has an ingenious scheme for better coordinating child care across different facilities in Dane County, and that could be used by other counties, and that's good. But what we proposed in the National Academy of Sciences report was that dollar for dollar, that if you're of a very low income level, below $10,000, dollar for dollar, you should have refundable tax credits for up to $4,000 a year in child care expenses for a single kid, and up to $8,000 for two kids. So in other words, targeting a tax credit that's refundable, that would have to be paid monthly, but could be in the same way the child allowance is, and it's targeted at low-income people, would give them access to costly, high-quality child care, assuming they could find a slot. And it would be at no cost to them, and it would allow them to not only have their children in a great situation, but also increase their work effort. That is the policy that we think most helps low-income families with children. But in general, everyone's becoming more convinced that child care before age 4, or before age 5, before pre-kindergarten is important, and that we should do more. Now, you should know one sort of funny conundrum. The adjustment we have for child care costs of going to work is a minimal one in our estimates. Why? Because it's based on what low-income families spend for child care. Low-income families can't afford good child care. That's the problem to start with. So we're just looking at not what they'd like to spend or what they should be spending, but only what they are spending, which turns out to be $1 or $2 an hour. So it's a situation that needs more help. If everyone agrees that child development is better served by child care early on, that the kids do better in school, there's uncontrovertible causal evidence that higher incomes and other things produce those outcomes. We need to find a better way to subsidize child care in our country and to spread it particularly to people who are most in need and who could work a lot more if they had that benefit.
Okay. So we have a question about how to get a handle on smaller areas. You know, I know that we need, sample groups of about 100,000 people to get reliable estimates. But what do you do for places like Menominee County that have a much smaller population, but presumably a higher poverty rate, or maybe smaller rural areas? What can you do to kind of get an understanding of those factors there?
Well, of course, the Census Bureau takes 5-year averages. And at the end of 5 years, the ACS can tell you can go online and you can almost get block statistics. You can get every school district. You can get every county. But that's lumping together 5 years. Now, we could, if we had the money, we could take the Wisconsin Poverty Report and take the samples for 5 years, make a price adjustment, and tie them all together. That would give you a better look at the way that poverty really was over that period in that area. But then you've got 5-year averages. And policy-wise, a policy that was started today might not have a big effect for a while, and it would be hard to detect it. So smaller areas are just more difficult, period. But what it takes is sample size. So it could be done. We could combine. We could get a long way in almost every county by combining 3 years of our data for the Wisconsin Poverty Measure in virtually every county. But if you wanted to really get into less populated counties like Menominee and other areas, what you'd have to do is probably take 4 or 5 years of that data and combine it. Again, it's something that could be done. And it would be better, I think, than what the Census Bureau tells you, because they're only looking at official poverty. At least you know the way that SNAP and refundable credits affected people in those areas. That's one thing that could be done, for sure.
Okay. We have a question about driver's license revocations, and I think I've heard you talk about this before, but Samantha says that about 59% of the revocations in the state are for failure to pay forfeiture, and just kind of this broader problem of a lot of lower-income folks who aren't able to pay these fines, either losing their licenses or having a hard time getting to work because of transportation issues. Could you talk more broadly about some of those things that are facing the state and maybe how that could, what we could do about that?
That's an issue. I don't know too much about that, Dave.
Okay.
I know that surprises you. but I don't know everything about it.
Okay.
I do know that low-income people, once you've been incarcerated and there are limits on what you can do in terms of driving and in terms of living in public housing and so forth. We have the longest probationary periods in the country, so if you make any mistake in 3 years, the average time, or if you haven't repaid a fine or something like that, you lose your license, you're not able to drive. And for a lot of low-income people, that really means that you're not going to be able to get to where you want to go or go to work. So that's difficult. I think that we should do better in keeping people with their licenses, to find ways to even garnish wages if you wanted to for people who can work so that they can repay their fines. But transportation is, in our state, we live and die by the car. Car is incredibly important in Wisconsin. People who get the earned income tax credit spend a considerable amount of it on insurance or better cars and better transportation every year, but those who don't get that earned income tax credit don't have much help. I'm for giving everybody who's qualified and knows how to drive a driver's license, no matter what their immigration status is, so they can get to work and back. I also think that people have to find a way to pay insurance as well, and that other than the driving under the influence issues we have in Wisconsin, which are big ones, that people should be allowed to drive, particularly when it's important for them to get to work.
Okay. So we've referenced this National Academy's report that you helped to write a few times, and in that report, the stated goal is, how would we go about reducing child poverty by half in 10 years? And I think one of my questions as we look at this report is, what might be a goal that we would want to look at in Wisconsin in terms of an overall number, and what are some of the things that would get us there?
Well, if we were at 10 now, if we could get to 5%, that would be wonderful. That would be wonderful. But the way you have to get there is to get mainly federal help. So one particular package that's very attractive, that something very similar has already passed the House Ways and Means Committee, that's Bill H.R. 3300. There are three things: a combination of a little bit bigger earned income tax credit, that refundable child care tax credit I mentioned before, and extending that $2,000 per person child tax credit down to the bottom so everyone got it, and paying it back monthly. Those three together cost the federal government $44 billion and reduce poverty by a third. So we would go from 10 to 7% in our state if we did that. If the state added on to its earned income tax credit, as was proposed by the governor, we could even get a little bit lower. And we could simulate these numbers if people wanted them. So a lot of people are trying to help, kids stay out of trouble, to help feed kids, to help make sure they're getting the health care that they need, that they're getting good education, that they're in good preschools. This isn't going to eradicate the need for those people, but it is going to make their job a lot easier. So Wisconsin would be a big beneficiary if we were able, on the federal level, to pass this legislation. Wisconsin for itself, like I said, the state EITC. Another really important thing is you increase the minimum wage. If you increase the minimum wage, more people go to work. More people work more hours. That reduces the cost of SNAP. That reduces the amount of money for housing subsidies because people with higher incomes pay higher rents, and so on. So raising our minimum wage to $10.50, which is something which is still ridiculously low, would do a heck of a lot for low-income workers in our state, the childless as well as those with children. I should say that 2 weeks ago, the Congressional Budget Office came out with another report on minimum wages, and essentially what it said is a $10.50 an hour or $10 an hour minimum wage is a no-brainer. There's no loss. It's all gain. People will get paid more. Hardly anybody will lose their job. If you went to 12, the calculus is still good. The calculus gets iffy at $15 an hour, in other words, in terms of the people who lose jobs versus those who keep them and make more. But it is a no-brainer to raise our minimum wage to $10.50 an hour as I proposed and the governor proposed, and why we're not doing it, and why no one's seriously talking about it, I don't know.
Okay. So, Tim, one last question. What are you looking at going forward here? What, kind of a parting thought for us? What should we be looking at for poverty in the state of Wisconsin, and what do you have to leave us with?
Well, next year I don't expect there's going to be a lot of change looking at the employment numbers. I can hope that we've made some gains. We do have tighter labor markets. The wage charts that I showed show that wages rose a little bit in 2018 compared to 2017. So maybe we'll do a little better next year, but my guess is when we look next year, we're still going to be treading water. And if we don't do something positive and direct, if we don't raise minimum wages, increase EITC, expand Medicaid, provide more child care slots, we're going to be looking at the same blah that we saw this year. We may see some areas that are doing well, and I think that's great. Madison is going gangbusters. Most of Dane County is doing pretty well. The suburbs of Milwaukee are doing okay. But the rest of the state's just treading water. And so if we want to do better than treading water, we have to do something at the state level and at the federal level.